I'm Rick Buck, and I've been a dentist for 15 years. In this video, we will go over 6 main possibilities as to why teeth might become sensitive or painful after a filling is done. So like and subscribe if you have teeth. The first possible reason your tooth may have pain is called pulpitis. Pulpitis is the inflammation of the pulp chamber in the center of your tooth, where its main nerve system lies. If a tooth nerve senses the drilling done on the tooth, it will increase the inflammation in the pulp chamber to try and heal itself. This inflammation also changes how the nerve reacts to make it more excitable or easily triggered, and can cause pain especially when cold touches the tooth. This inflammation can dissipate as the tooth heals, which is called reversible pulpitis. The inflammation can also get worse if the tooth doesn't heal, and this is called irreversible pulpitis. And the tooth, if it has irreversible pulpitis, will eventually die and become a breeding ground for infection. This rarely happens to my patients if I've done a filling, but if it were to happen, I normally have them take ibuprofen for a few days to reduce inflammation. And it normally doesn't progress to irreversible pulpitis if it started out as reversible pulpitis. If you had a really deep cavity or the tooth heated up too much while drilling, it increases the chances of pulpitis. But just beware, anytime you have a filling, there's the possibility of sensitivity. Let's now move on to dentin hypersensitivity. If you remove the enamel from your tooth and looked at the underlying levels of your tooth with a microscope, you would see a surface of tubules. These tubules connect to nerves that stem from the center nerve in the pulp chamber of your tooth. The bigger the diameter, the higher the density, and the total amount of those tubules there are exposed, the more likely each individual will experience pain to cold, touch, and sweets. So once again, the more and the bigger of those tubules are exposed, the more likely you'll have sensitivity. Most of the underlying exposed tooth surface is called dentin, so that is why we call it dentin hypersensitivity. And just so you know, most fillings require that a dentist drill down to the dentin layer, so most fillings could possibly trigger some sort of dentin hypersensitivity. 3 things can affect hypersensitivity at the time the dentist works on the tooth. First, the deeper and wider the filling is, the more likely it causes hypersensitivity. Second, if the dentist doesn't use an adequate amount of bonding, or if the bonding doesn't set right, you are more likely to have sensitivity. Third, dentists have desensitizers they can use before bonding a filling into place that reduces sensitivity. In my practice, I make sure to keep fillings as small as possible. I almost always use desensitizers and thoroughly bond the fillings to the tooth. And for those reasons, I rarely ever have sensitivity with my fillings. If the hypersensitivity doesn't go away, it normally requires redoing the filling. Moving on to another mechanism of pain from fillings has to do with stress on the tooth. When we do a white composite resin filling, it is a doughy resin that we pack and mold into place. When the filling hardens, the resin shrinks about 1 to 5%. This filling shrinkage can pull and put stress on the tooth, causing an odd sort of biting pain. Normally, this is a pain that only comes when biting just right or in a certain direction on the tooth. A dentist can minimize the chance of this happening by adding the filling in layers, or using something called a liner below the filling, or even using what we call a bulk fill layer before the final layer of resin. And so those are 3 ways to reduce the possibility of this. I like to use a liner on almost every filling that I do, and that is the main cause of low sensitivity that I've experienced. Now, sometimes as a patient, you will just get unlucky, and this will happen even though the dentist took every correct precaution. Redoing the filling is normally the best starting option to see if just redoing the filling will help the tooth feel less sensitive and release the pressure. And then normally it will get better from there. And then if it doesn't get better, then you have to explore other options. The next possibility is pain due to inflamed ligaments. You see, you have little ligaments that anchor your teeth to your jawbone. If too much pressure goes on those ligaments, the tooth can become sensitive and painful when biting. You may have noticed that the dentist had you biting on a piece of blue or some sort of carbon paper at the end of your appointment and asking you if the tooth feels even or normal when you're biting down. We know it's hard to tell when you're numb, but we're doing our best to make sure the filling isn't too high. If it is too high, the tooth will take more pressure than the other natural teeth, and the tooth ligaments that hold the tooth in place will become stretched and bruised and painful. Luckily, the solution is simple, as the dentist just has to file down the filling a little bit and give the tooth a little time to heal, and those ligaments will heal up and become less painful. Quickly, my favorite toothbrush, floss, and other dental products by far are in Amazon affiliate links in the description below this video. Those dental products will give you stunning results every time you clean your mouth. And you can also watch my video posted at the end of this video to see why they are the best and how to brush and floss your teeth with immaculate results. Let's move on to the mechanism of gum irritation. When dentists work on teeth, sometimes the surrounding gums take a beating to help us accomplish the filling. This normally manifests as just a general soreness without cold pain. Though if this happens, there can be some biting pain too. Normally, this will heal up on its own in a few days. In the meantime, clove oil or something like Orgel will help this feel better if the pain is excessive. But there is another type of gum irritation with fillings. Sometimes a tiny piece of the filling or the bonding pokes out into the gums. For how tiny this piece can be, it can be very painful. Normally, this manifests as a biting pain that kind of increases over time and is really sensitive to the touch or to floss the gums. The fix just takes finding the spot and smoothing out the filling, though you may have to be numbed by a dentist to do this. This is more common on white fillings that extend beneath the gum level. Another type of gum irritant can come if the new filling is trapping a lot of food when you eat. This happens if the filling doesn't butt up tight to the tooth next to it. And if this is the issue causing your pain, you'll notice lots of debris coming out when you floss your teeth. Another way you can tell if the filling is adequately contacting the adjacent tooth is if when you floss, the floss snaps through, as opposed to just kind of gliding through without any resistance. But I've seen even tight filling contacts that still catch food. If this is happening, you'll likely have to redo the filling and make it even tighter. In the meantime, remove as much debris as possible by tying knots in the floss and then snapping the floss through your teeth and threading the knots back and forth until you remove all the debris from between your teeth. To further narrow down your pain, I have more in-depth videos on the symptoms, relief, and causes of dental pain. As well, I have a video that shows you each step of how I do fillings, especially to avoid sensitivity when I'm doing the fillings. Watch my daily dental care video I have posted now for the best technique, tips, and product recommendations for a stunningly clean mouth that avoids tooth decay, gum disease, and gives you fresh breath. The best dental products that I recommend are in Amazon affiliate links in the description below. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.